Good morning, everyone. My name is Dr. Romina, and every Wednesday I come to you and talk about different topics from my clinic. This is the office, just so you know. We got some nice view up here. And you're more than welcome to reach out to us or come see me, and I'll be happy to take care of you or guide you in the right direction if I can't. So today I wanted to talk to you about cervicogenic. It's becoming a lot more prevalent than before, and you will learn why that is the case. So send your questions over, please, in the chat, and I will answer them at the end. All right, or hopefully you'll get your answer throughout the process. So this is me, and I've been in practice over 25 years. I'm a graduate of 1995, and my life quest and education and continuing educations and certifications have all been about health and wellness without drugs. So I remember when I was 13, all I wanted to do is to be a doctor that didn't give drugs. At that moment, I didn't even know what chiropractic was, but I guess chiropractic found me, and here we go. Let's talk about cervicogenic headaches, cervicogenic vertigo, and talk about that. Interesting enough that cervicogenic headache, it's typically, very often, is related to your neck, and which is when a person feels like either they're spinning or the world around them is spinning. So there's two types of vertigo. There's objective and there's subjective. Objective is when the world is around spinning, and subjective is when you're spinning. Your vertigo and your dizziness comes from your inner semi-canals of your ear. So semicircular canals of your ear. But a lot of time in this particular presentation, we only are going to focus on cervicogenic headache, not other factors such as cranials, ear problems, tumors, and other etc. stuff, okay? So let's focus about causes of cervicogenic headache. Do you have anyone or know someone that looks like that, or you are looking like that? So does that explain why, if cervicogenic means it originates from the cervical spine? That's why it's called cervical, which is the cervical spine. Genic stems from vertigo, is the dizziness that happens in the ear. So when the pathways or the neural impulses to the ear have been positionally changed and they're bombarded by neurological stimulation that I'm in a changed position, it's very common to get that vertigo problem. So people who drive a long distances, they tend to be in a poor ergonomic setup. Kids these days that have poor posture, don't be surprised if at the age of 20, 30, or even 40, they start complaining of dizziness. And this is a very scary feeling because it could happen anytime. It could happen with a sneeze and your world spins. You can't move, you're sitting. And if you sneeze and you're driving and you get this condition, not only you put yourself at risk, but you put everyone around you at risk who are not supposed to be like that, okay? Who's not supposed to be at risk. So poor posture is not just an aesthetic problem. It's a physiological, neurological insult to your inner body. So let's dive into that a little bit more, okay? So the dizziness is most often occurs after moving your neck, right? It affects your sense of balance, but worse than that, when your world spins, there's nothing that you could do to even try to concentrate. So any tasks that require attention and concentrations are dramatically at risk when you have cervicogenic headaches or cervicogenic vertigo. I had a lecture about cervicogenic headaches. I'm a little bit stuck on that. So cervicogenic vertigo is a problem that is preventable and it is treatable, right? It's not like your other, but it does take time. So some of the things that I want you to realize is that preventing the problem right now while you're treating it and continuously preventing it for yourself and for the people that you see are going into that path is a personal responsibility after learning what you have learned. So let's talk about acute and chronic neck pain and what happens. You see, the common causes of cervicogenic vertigo is that you actually get an insult of the blood flow to the inner ear and the base of your skull. So if you take your fingers and rub it around your hairline, you see that hairline area? That's your suboccipital area. That is where your brainstem sits, at the same time where the greater occipital artery and nerve pass through. So this occipital nerve affects the position of the base of your skull, which is right here, the first vertebra, which where we call them atlas, because it actually holds your whole head to your world, and the second vertebra, where we call axis. Axis is the second vertebra in the neck that actually moves around the axis, right? It moves around your world. So when these three are out of alignment, or they have any kind of impact, whether it's vascular due to the occipital artery, whether it's neurological due to occipital nerve, or whether it's musculoskeletal, either wrong information to the muscle spindles or irritation of the nerve receptors, they will affect the position of the skull, where it affects the position of the semicircular canals in your ear and can cause problems, imbalance, and that will lead into vertigo. That's where the problem is coming. The vestibular apparatus is that semicircular canals that are in your ear. So what happens? A couple of things that are typical symptoms of, I'm sorry about the spelling problems. A couple of symptoms is obviously you get neck pain, you get upper back pain, discomfort, you can get headache, you can get nausea, vomiting, ear pain, or even ringing, neck pain. Loss of balance is the typical trademark. Dizziness, obviously, it's another one. Lack of concentration. So if you're in the middle of your work and all of a sudden your brain stops and you lose your thought and you almost have a brain infarct at that moment, those are the things you definitely want to have your physician evaluate you, not just your vascular system, your neurological system, but also your ear balance as well. Dizziness from cervical vertigo can last a couple of minutes, or it may last hours, where a person has to sit. They just cannot move, period, or has to lay down. There has to be some kind of a tactile stability, either through sitting and not moving, or laying on the ground. So the other sensory information tells the brain, I'm stable. And this is where your skull is misaligned. So let me ask you something. When you are holding your phone like that, do you tend to have your head down? Do you tend to stand on one side or look the other way? When you're watching TV, or is your monitor not positioned in front of you or positioned to the side? Because you're inducing a biomechanical interruption in your body that will set you up for misalignment and will set you up for a neck problem. And when we talk about neck pain, we're not just talking about the actual neck itself. The muscles that hold your neck really stem from the middle of your back. They are the lower point of your trapezius muscles or the beginning of your latissimus. So poor ergonomics at your work, poor ergonomics of standing, sitting, walking, sleeping will all affect you. Therefore, when we talk about neck pain, don't just think about here. Think about your whole body as a kinematic chain. And if you have any questions about that, about posture or kinematic chain, please go to my website, thinkhealthy.com, and look at our blogs, articles, or news, recent information, and you'll definitely find a webinar on that, 30 minutes. So what do we do? When you come to the clinic after doing an evaluation and symptoms and finding out your history, we start an examination. One of the most identifying factors for vertigo is to rule out other factors, right? So we want to make sure that there's no benign positional vertigo. Benign positional vertigo is typically a vascular problem. So that's basically a blood pressure standing up, blood pressure standing down, laying down. The change in the sudden change in that would be an indication. Then we look for central vertigo. It could be due to a stroke. Is there a tumor? Is that a multiple sclerosis? Is it a psychogenic vertigo? You know, we have a lot of issues of that going on. Is it an inner ear disease, or is it a vestibular neuritis? So we do need to rule that out. So This presentation is not to diagnose or treat you. This presentation is to educate and inform you that when you have vertigo, you do not take this matter lightly, and you do not call your friends to find out what to do. You have to seek professional care to make sure there's nothing other than that, but it's only a cervicogenic vertigo, okay? One of the examinations that we do is we have the patient turn their head back and turn their head around, and we put them in extension, and we look at their eyes. And usually the eyes start wiggling, or what we call nystagmus. They go horizontally in rapidly movement, which we call that nystagmus, right? That sporadic eye movement is an indication that the person has a cervicogenic vertigo. Also, ear exam, balance exam, and cranial nerves are the most important ones. So additional diagnostic tests are important, where we do an MRI evaluation to see if the problem in the neck is actually a disc problem, or is it an arthritis problem, degenerative arthritis. We might do a Doppler study, and that is to check the integrity of the vascular flow to your brain, which is the greater occipital artery that we talked about. The vertebral arteries are very important. Flexion extension x-rays are very important, especially if you've been in a car accident or in a whiplash injury. A lot of times you might treat the problem. Maybe it happened a few years ago, but you may have had a tear or a micro tear in the anterior or posterior ligaments that are holding your vertebrae together. If there has been a tear that caused instability, that instability can shift the bones easily long after your case or your accident has been treated and done and closed. This is actually only identified by flexion extension x-rays. Do not bother yourself with an MRI to identify a ligamentous instability. Why? Because it's motion driven, whereas an MRI or a CT scan are all static, right? So you definitely want to take a dynamic evaluation of that. Also, evoke potential tests are very important, which find out the pathway affected. We're looking at more of a multiple sclerosis situation. So what are your treatment options? So treating the underlying cause is more important, and identifying that is essential in the journey of treating your condition. If you're experiencing neck pain or have degenerative neck disease, it's very important to get treatment immediately. That will decrease your vertigo symptoms. You might even get some medication prescribed by your medical doctor to reduce the stiffness and dizziness. However, they will recommend definitely some form of physical rehabilitation. So whether it's with your chiropractor or whether it's your physical therapist, both of us are here, both of our professions are here to help you. Well, one of the things, should you have or should you be diagnosed with cervicogenic headaches, the most important cervicogenic vertigo, I can't get out of my mind. Cervicogenic is to take care of the neck. So there are a couple of things you can do that you could self-care. So there's short period of tests like applying ice, heat, gentle stretches, but know that cervicogenic vertigos are aggravated by exercise. So you have to be very, very careful in what type of treatment you're receiving. Maybe not at the beginning, but your rehabilitation or your physical care has 3 phases. Phase 1 is acute, which is very passive. You really don't do much. It's mostly very gentle stretches, and it's done by a therapist or a doctor. Phase 2 is more what we call subacute, where your symptoms are dropped at about 50 to 60%, and we become a little bit more mobile, more proactive in movement, and giving you some beginning resistive exercises. And phase 3 is where we actually add neuromuscular retraining, where we're trying to build your nervous system and your muscular system as well. By rebuilding neuromuscular system is we're basically retraining your muscle memory to stabilize your condition. So it's acute trouble, correcting the underlying cause, and prevention or maintenance. So that's 3 phases. Affecting, and just so you know, your treatment is not just what you get when you come into clinic. Your treatment is actually the other 8 to 9 hours that you spend at home. So evaluating your work status, your sleep habits is very important. So let me show you a couple of things that it might benefit you, all right? One of the things that is a very exact indicator of a degenerative joint disease or atherosclerosis or a disc problem in the neck is, excuse me, radiating pain. Radiating pain is typically a compression of the head. So one of the things that helps is a traction in your neck is a very passive beginning kind of a care. And also reducing the knots in the muscles is another one. Resistive exercises are very beneficial. So those are indications. And if you have a specific nerve pathway or specific radiating pain, depending on looking at that picture, depending on where that pain leaves, tells you what level of the spine is being affected. All right. So whether it's a C5, C6, C7, C8. If you have that with vertigo, please note that you already have the upper cervical, which is occiput C1, C2, also affected. So one of the things that I also have helped put together is I put together a little kit. So these are the ones that I have here behind me. So you can go on my website and get the kit that you need. If you have vertigo with headaches, get the headache kit. But if you have vertigo with neck problem, it's more beneficial to get your neck kit. But if you don't have a headache and you don't have a neck ache, but you do have, let me show you something. Ah, there we go. Lost it. Okay. But you do have poor posture and you have vertigo, or you have this forward head position, get the posture kit. Or if you don't have any of those, get an ergonomic kit because of something you're doing at work that's affecting it. So you have the option of treating the headache to helping with the headache in order to reduce the symptoms while you're getting professional care, or the neck traction is going to be immensely, immensely beneficial for arthritis in the neck and any radiating pains. Posture kit is going to be very effective for your full posture. That's like hip, lower back, mid back, neck, and shoulders. And obviously the ergonomic kit is going to help you if you don't have a proper ergonomic stance. So in your kit, you also will get a posture support. A posture support retracts your whole entire spine. And that by changing the middle and shoulder of your body, the neck and the lower back have no other choice but to follow suit and change in the biomechanics. We recommend BAX-U because it's the only one that has, well, it's approved by PPO and FSA, HSA plans, but most importantly, it's tested by University of Michigan. There's corporate wellness studies and there is athletic studies that prove it is beneficial and it does have a long-term effect. And you'll notice the changes within the 12 weeks. So a good night's sleep is very essential for your wellness, but what kind of pillow do you use? There's so many different types of pillows. A poor sleep position will affect your neck problem, which can contribute to your cervicogenic vertigo. So there's two types of pillows that you may need to choose. One of them that make you feel good and the other ones that are good for you. So one of them has a functional benefit, the other one has an emotional benefit, okay? So if you choose the type of pillow that's right for you, perfect. Now let's go ahead and choose the one that is right for promoting a better curve in your neck while you're sleeping. I personally recommend number 2, 6, 4, and even 3 to my patients. My most common ones that I recommend is 2 and 6. If you already have a good curve, recommended, approved by your doctor via your x-rays, that's the only way that you could tell, then number 2 is going to be very beneficial for you. And you can choose the consistency based on what kind you like. But if you're trying to correct, if you have a straight neck, reverse neck, or arthritic neck, you definitely want to choose somewhere between 3, 4, and 6. Those are going to be very beneficial for you. If you have a really poor forward head carriage, you definitely want to take your body into a gradual shift not a sudden retraction. Okay, so check with your chiropractor, your physical therapist who knows about biomechanics to give you that guidance and help. Working from home has been one of the culprits of upper back, neck pain, shoulder, and even new cases of vertigo on the rise. And that is because a lot of people are moving from their bed to the couch, to the coffee table, to the dining table until they find their workstation. So knowing your proper ergonomics is very important. And if you are interested, definitely send us an email or send me an email. I'll send you the basics ergonomics that you need to apply in order to make your workstation very effective for you. I did put together a little home toolkit for this. I call it Ergonomic 101. So basically, I put together a whole array of things that you would need. One is going to be a sit-stand desk if you do not have that. This is adjustable, so it goes from your bed to the coffee table to dining table. I recommend you stand during the day and sit in the afternoon. Reason being is you do not want to cause over compression to the vascular supply of your legs. You do not want to create restless leg syndrome. You do not want to cause sciatic problems. That's why it's important to have a nice balance. If you are disciplined, make sure that you can alternate between sitting and standing by alternating every 2 hours or taking a break every 2 hours. Very essential. Changing your view instead of just focusing on your monitor, changing your distance of your view is going to help your eyesight not to be degenerated as fast either. So I hope this was effective. I hope this was helpful. I'm here to help. I'm here to share my knowledge. And every Wednesday I come to you and I call it Wellness Wednesday webinars. Join me, invite friends and family, and I'll be happy to share and talk to you about what needs to be done. And if you have any other questions, please don't hesitate to reach me. I'll be happy to answer any questions. If you have questions about headache, neck pain, actual neck pain, back, hip, knee, ankle, you're more than welcome to go to my website at thinkhealthy.com or go to BAX-U.com where we actually have our products. I hope this webinar was effective, helpful. Join us on the next one as we talk about different topic. Thank you again and see you soon.